Okay, today I'm gonna start on my patient assessment. First of all, I'm gonna practice hand hygiene. And now I'm gonna introduce myself to the patient. Hello, my name is Richard Eugene. I'm your nurse today. Can I have your name, please?
Vanessa.
Okay, since I'll introduce myself, now I'm gonna identify if I have the right patient. I'm gonna check her band ID band. Your first name is?
Vanessa.
Your last name?
Henry.
Can I have your date of birth?
03/13/99.
Okay, now I have the right patient that I read on the chart. Okay, now I'm gonna start with my patient alertness to see if my patient is alert in the normal level. What day is today, Vanessa?
Sunday.
Okay, good. Where are you at right now?
At the clinical setting.
Okay, perfect. Can you tell me who is the president of the United States?
Joe Biden.
Okay, perfect. Now I can see my patient alert status is up. Alert and oriented time 4. Because she knows everything. She knows herself. She oriented, and then she knows time, everything. She is very calm and good mood. All right. Vanessa, is that correct today? I perform an assessment, body assessment on you?
Sure.
Okay. I'm gonna start touching your head. Is that okay?
Yes.
Okay. I'm gonna looking for if there any lumps or mass. I can see there's no lumps, no mass. Okay. Now I'm gonna assess Vanessa eyes to see what reaction have their pupils. I'm gonna use my flashlight to check her pupils. Can you open your eyes, Vanessa, please? Okay, good. Okay, perfect. There's reaction. Let me check your conjunctiva. Okay, pink. Okay, it's correct. Now, since I'm on Vanessa's head, I'm gonna check her temporal pulse if they are present. Both sides are present. Okay. Now I am gonna perform her nose assessment. Vanessa, can you tilt up your head? Do I can see the nose tilt? Okay. Okay. There's no secretion, there's no drainage. Now I'm gonna ask Vanessa to clap one of nostril. Vanessa, can you clap one of your nostril? Breathe. Perfect. The other side. Breathe. I can see there's no obstruction. She is breathing very well. Okay. So now, Vanessa, I'm gonna ask you to open your mouth. Do I can assess inside of her mouth with my light? Okay. I can see pink and moist. There's no inflammatory process. Okay. All teeth are present. Thank you, Vanessa. Now, since I'm on head assessment, I'm gonna check her ear to see how my patient got her ears. There's no drainage, no secretion. And the other side, there's no drainage, no secretion. Okay, perfect. So now, Vanessa, I'm gonna check on your neck. First of all, I'm gonna go by the inspection. Okay, I can see. Okay, the skin is uniform. By inspection, the same color of the rest of the body. Now, let me palpate to check if there are lumps or mass. There's no lump, no mass. Okay. Since I'm already on her neck, I can check her carotid pulse. Present, bilateral. Vanessa, I'm gonna ask you now to move your head up, down, this side and the other side. Okay, my patient has also a good range of motion on her neck. Okay, now I already have my patient neck and head assessment done. Now, Vanessa, I'm gonna assess your heart. To assess your heart, I'm gonna listen in all the sound of your heart if they are regular. Okay, so now I'm gonna listen to your apical pulse, which is on the fifth intercostal space in the mid clavicular, right here, for 1 minute. Okay, 80 beats per minute. That means my patient heart rate is regular, is in the normal range. Okay, so now, Vanessa, I'm gonna check my patient pulse and extremity superior. First of all, I check the brachial pulse. Okay, one side. Both sides are present. Now, let me check your radial. Both sides are present. And then, let me check on your capillary refill. Less than 3 seconds. Okay, that's correct, Vanessa. Okay, so Vanessa, now I'm gonna assess your lungs. To assess the patient lungs, you have to assess the chest anterior and chest posterior. Now I'm gonna start on my patient chest anterior. Can you take a deep breath, Vanessa? Okay, deep breath. Perfect. Very clear. Deep breath. Deep breath. There's no quakers. There's no bronchi sounds. My patient lungs are very clear. So now I'm gonna ask my patient to lay back down. Do I can continue with her abdominal assessment? Please. First of all, I'm gonna start with the abdominal inspection. I can see the abdomen, first of all, the color of skin. The same color of the rest of the body. Okay? Non-tender. Okay, wounded. Okay. So now I'm gonna go by the auscultation. All songs bowel are present in all four quadrants. Let me focus. Okay. Now I will palpate her abdomen to check. Okay, abdomen soft. No lumps. No mass. You feel any pain, Vanessa?
No.
Okay. Okay. While Vanessa is laying down, I'm gonna check her femoral pulse if they are present. Both are present and both sides, that's mean. Okay. And then I'm gonna check the popliteal pulse at the same time. I check here, right here. For the first one, is present. Okay. The second one is present too. They are both present. So now I'll check the pedal pulse. Okay, thank you, Vanessa. The first one is present, and the second one is present as well. Okay, since I'm here, I'm gonna check if there edema on extremity inferior. There's no edema on this side. To check the edema, you can see and feel it too. You have to touch, not only watch. The second check. So now I can feel and see there's no edema on inferior extremity. Okay, so now what I'm gonna ask Vanessa to do, I'm gonna ask Vanessa to sit down again. Now I'm gonna check on my patient the range of motion for extremity superior. Vanessa, you're gonna bend your arm like that, and then you're gonna push my arm out. Okay, in. Perfect. You're gonna do the same for your extremity inferior. Try to open my arm. Okay, in. Perfect. So now I can see my patient have a good range of motion. Okay, so how do you feeling during the assessment, Vanessa?
I feel good.
Okay, any pain?
No, not right now.
Okay, perfect. Any question for me?
Now is everything okay with me?
Yes, everything is on normal range.
Thank you.
According to your assessment. So now you're gonna sit down and wait for the doctor to come to see you. Okay?
Thank you.
You're welcome. Have a good day.
Thanks.
See you.